your health. And my guest is the one, the only, Dr. Stephen Olawuyi. Good evening.
Good evening. Thank you for having me.
My pleasure. As always, Lagos, you know what to do. You have questions you want to ask or you want to contribute, you can come through on WhatsApp. The number is 0809 444 0981. And, well, Dr. Olawuyi will be, shedding more light on how it is we need to be practicing preventive medicine, or, I like to say it's preventive medicine, as opposed to just letting things run amok.
Yeah.
But how does preventive health contribute to early detection and successful treatment of conditions? Why do we even need to be checking up or, be preventing ourselves from falling sick?
Thank you very much for that question. And when you're talking about preventive medicine, there are different classifications, right?
Okay.
There's what we call the primary prevention, where you want to do all you need to do so that the disease does not even come at all.
Okay.
So for instance, we're talking about vaccination. We're talking about promoting healthy lifestyle, diet, exercise, right? And then, so we're talking about education. So at that level of prevention, you're talking about education about the risk factors so that the individual does not even have the disease in the first place.
Great.
And then we'll talk about secondary prevention, where you want to early detect diseases to prevent the complications. So for instance, when we talk about doing your mammogram by every woman before 40, doing your pap smear from 25, as a man your PSA, right? And then we'll talk about the tertiary prevention, where you're trying to deal with an existing disease so that it doesn't get worse, or what we call about rehabilitation. So if you look at prevention, the whole idea is to either to prevent the disease from happening in the first place, rather than, so we're talking about you're taking a proactive steps so that you don't get ill, you don't get sick, right? Because there are so many risk factors associated.
Right.
So we have to look at that. And looking at the socioeconomic of Nigeria, I'll think we go with primary prevention, where we are educated about the risk factors to some of these diseases, so that you can don't get the disease in the first place. Right, or you then go to secondary prevention when you also know the risk factors associated or the tests associated, so that you don't get the disease, and then also prevent the complications, so that you can pick them early and then prevent the complications from happening.
Which is good.
I hope that's clear.
Yeah, very clear. Thank you so much. That just makes life easier. Don't wait for things to creep up on you. So if you're preventing it way earlier, you wouldn't be caught in any, ailments, debilitating ailments.
In a serious state.
Yes.
Right.
So
yes, in the serious state where there's little nothing you can
do about it.
Right.
That's why, doctors always preach prevention is better than cure. So don't wait for any cure before you can. If you know you can prevent it, please do that. And that is how you also get to, get insight on preventive healthcare. So, but what are the risks usually associated with skipping routine checks? I know that you've mentioned a few, those who get to have their mammograms. If they do that early enough, they're able to detect if they have breast cancer. But say someone is usually scared or doesn't want to do these things, what are the risks associated with them?
Okay, thank you. So there is a saying common, in our society: what a man does not know can kill him. And I said, no. When it comes to medicine, what you don't know will kill you. It's just a matter of time.
Right.
Ignorance is not bliss. Ignorance is not bliss.
It's not.
So number one, the risk factor associated not getting tested, delay detection of disease, right? So conditions like cancer, diabetes, hypertension often have no early symptoms. So if you don't do regular screening, you can pick it up early, and then you can then have the complications. Increased complications. If we don't detect early, right, the disease gets more serious, and then that can determine more complication than when they are,
just
identified early. Then higher healthcare costs, right? If you pick a cancer at stage 1, the treatment, the amount you're going to spend is not going to be as much as when it's at stage 2, stage 3, stage 4.
True.
Right?
True.
And then also reduce treatment options. If you come at stage 4, right, when it has metastasized to most organs, the options of survival prognosis is small.
Yeah.
Right?
Yeah.
And then it then goes to the next one, which is lower survival rate. The risk factor of not getting screened, allowing a disorder to progress, can lead to the fact that you might not be able to survive it even when treatment commences. Right? And then talk about palliative care. And then another thing is you prevent the spread of infectious disease. Especially when we talk about HIV, AIDS, hepatitis B and C. Right? You should do those screening regularly. Know your status, and then prevent the spread. So the risk factors are enormous, from cost, delay, detection of disease, increased complication, and then death as a result of late onset of identifying the diseases, and then which then limit the treatment offering and prognosis of that disease.
Okay. I like how you've highlighted that, and that is why I want to know, how regular should one go for, or how regular should one prioritize health screenings?
Okay, so it's something, I think we start with what we call know your numbers. The first of all, chronic conditions.
Okay.
Everybody should know what their blood pressure is. They should know that sugar, right? You should know that.
Okay.
Right. So those are things you should know your cholesterol scores, right? Cholesterol screening, right?
Okay.
And then you then go further to more detailed tests, maybe your kidney function test, renal function test, how your heart is doing. Now, the first one I mentioned, you can do that more often to check.
Right.
Then the other ones later, you can do maybe twice, or do you understand, once or twice in a year, right? Depending on how much the person sees the doctor. Then we talk about cancer screening, right? Cervical screening test for every woman from 21 to 65, right? Breast cancer screening for every woman from 40 years old with mammogram. Then we talk about colorectal cancer, right? Which is from 4 to 5. Prostate cancer for men. Anyone above 40 should do a PSA test regularly. And then we talk about, HIV and STI screening for those who are, sexually active, right? And then hepatitis B. Then the other screening, your eye test, your dental checkup. Many disorders can be picked from the screening. For instance, just examine your eyes. I can whether you're diabetic. It can give me a clue whether you're hypertensive. Or if I check your oral mucosa to see how hygiene your teeth is, it can even pick many conditions from there. And then, so looking at that, know your numbers, to organ screening, to cancer screening, and then to major body health screening. Those are the things. And what I tell people is this: the money spent on yourself is not an expense, it's an investment.
Right. So
we must ensure to do that screening, because we want our body to be healthy and to carry on throughout time of our existence, to be healthy enough to be able to achieve our hopes and dreams. Right. So it is important to know all these screenings that I've mentioned.
That is very insightful. Thank you so much, because sometimes when you let things go or just you're unbothered, it's that time that the disease that you do not know is creeping up and is getting into your system, making you more sick than you actually thought. And by the time you decide, okay, maybe it's gone beyond where help could come through, there's nothing else that can be done. So please don't just sit back and think, I'm going to spend money. What's that? I'm fine. And that brings me to ask, how can individuals make routine check more manageable in their lives? I know that, yes, it could be a bit of an expense, but how can they make sure that they're able to do this?
I think the first thing is you must prioritize it.
Okay.
Right. You said you must prioritize your health. You must prioritize that, like you said, what you do know with your body is important for you to keep functioning, and a good healthy state. Then your health is the most priority in there. And so with that, you can then plan yourself. Right. One way you can do is have an HM. Right. Most of these HMO plans have wellness screening. Yearly, at least once in a year, that check for most of these conditions we've talked about. Right. But some of them, some of them might not, depending on the plan, they might not cover everything.
Okay.
So you have to be, intentional, right? Sometimes you can use technology, create a calendar, like I said, some of these tests you can do them at least once in a year, right? So that you can follow, keep tab. And then another thing is reduce risky behavior that would, then endanger you to have condition. You understand? So create an healthy, friendly environment for yourself. Practice your self-examination. Have a timetable, for your health screening. So if you adopt all these, things I've highlighted, then you can ensure to take care of your health to get what you want.
So someone is listening right now and is considering, probably getting more help, but doesn't know how to. What advice or practical strategies can that person adopt to make sure that they are more consistent when it comes to their healthcare?
Okay, so when it comes to practical strategies in terms of, to what you keep with regards to your healthcare, the first thing is you must, like I said, be intentional.
Okay.
Right. Have a routine time to do some. Now, there's quite a number of, gadgets that helps to remind you of when to do set a timetable for screening, right? Prioritizing, your routines. Another thing is to adopt a preventive mindset. That's the first thing.
Okay.
Remember we say that at the level of prevention, you can even prevent the disease from happening at all.
Right.
And then you can follow it up with, secondary prevention for some of those diseases that come, either as a result of age or a certain thing as a result of gene. So prioritize, have a preventive mindset, have a calendar schedule in terms of, when you want to do your screening, right? And then save up for it. Like I said, I tell somebody, how much does it take to do one of these tests in a year? All these tests in a year. And I said, it's not as expensive as people think.
Okay.
With a minimum of maybe 60 to 50,000, you could do quite a number of them, right? That are important to to keep you. So you must prioritize your health, knowing that your body, like I said, is a vehicle that conveys you around. If it gets damaged, you cannot go in a car, right? You cannot go. So, and I tell people, it's on your sick bed that you know that the only thing important is your health. On the sick bed, you forget every other thing that matters. Your work, your family, all you're just praying for is
let me get better.
Right. Just get better. So if you then understand that, then you know you have to you must be intentional about your screening, and you must create time to check your screening and to visit your doctor regularly. And one way to do that, like I tell people, is through your HMO. Okay. I see friends who, out of the blues, they get ill, they want to go to the hospital, and the amount to pay for one visit is equal to what you pay premium in a year. So you just naira-wise, pounds foolish. Right?
I know, right?
You must subscribe to an HMO that can give you accessibility to healthcare. At any time I fall ill, I can just enter the hospital. I'm not bothered about finances or
finances are.
And then at the same time, it comes with a health screening that you can do to check how your body is, caring. So those are the practices that have a presenting mindset. Set a timetable for the screening. Keep a log also for most of your LV numbers, your blood pressure, your blood sugar, your cholesterol. Thank you.
All right. Thank you so much, Dr. Stephen. It's been so enlightening. I wish we could keep talking and going on about our health, but as you know, time is never our friend on the Accident and Safe Cruise, but it is always an insightful session. So I want to say a very big thank you for, shedding all that light. And Lagos, I'm sure that you also learned a thing or two and why you need to prioritize your health. Well, practice being mindful about going for your checkups and the likes. Don't wait till last minute and then having to remove such a huge chunk from your pockets to do such things. However, to learn more about your about the Mansard Health Plan, what you can do is visit their website, www.axamansard.com, or call toll-free 0700 AXA Mansard, and that way we'll be able to, they'll be able to attend to you, all the questions you need to ask, and so much more. But social media platforms are also available for you to get in all that access. On Facebook, Twitter, and on LinkedIn, it is at AXA Mansard. Have on Instagram, it is at AXA Mansard _, and you can get all the information that you need. But this is how we draw a curtain today on the AXA Mansard Safe Cruise. As always, you need to take care of you, so your body doesn't take care of you when you least expect.
AXA Mansard Safe Cruise. Brought to you by AXA Mansard Insurance PLC. AXA, know you can.